6:36 is our time now. A recent study by Fair Health reveals just how difficult the pandemic has been on our youth. The report shows a rise in self-harm, substance abuse disorders, mental health diagnoses, and a decline in overall mental health. Joining us now for our weekly series on kids and COVID-19 is Dr. Namisha Amin, a local pediatrician. Dr. Amin, thanks for being with us as always. We appreciate it.
Of course. Thank you for having me.
So reading through this, the researchers said findings showed a profound impact on mental health, especially in young people. And there are some startling numbers here in this paper. They really took me back here. For instance, cases of intentional self-harm as a percentage of all medical claims in kids 13 to 18 years old were up nearly 100% from April 2019 to April 20. And in parts of the country, they more than tripled at one point. Do these numbers shock you? Do you think that this trend is going to continue? And what needs to be done to curb the effect?
I think that the numbers don't surprise me, to be quite honest. They are much higher than I expected, but this is absolutely what we saw even here locally in Kern County when the pandemic started. And the study did show, fortunately, that the numbers did start to taper off. I think as people began to adjust to what was our new normal, they certainly did not remain that elevated. But absolutely, I would talk with my colleagues, and particularly when the pandemic started, it felt as though most of our visits were mental health visits as opposed to routine pediatric issues like ear infections or allergies or even the common cold at that time. In terms of what we can do to help curb this and essentially get those numbers back even lower to where they were in 2019 or better, is to get our kids safely back in school, in sports, in their extracurricular activities, and socializing with their friends. And of course, this has to be done in a safe manner, but this is the outlet for our children that helps them with their mental health, not just their education or their development.
Yeah, and, you know, in tandem with that, I noticed there was a graph on cases of self-harm, and they did spike when the kids were sent home from school last spring, and then again when school normally starts in the fall, and that didn't happen for so many children. Okay, and you know, there are so many things looked at in this, and one of the things was at young children. I'm talking 6 to 12, and it showed reports of obsessive compulsive disorder and tic disorders were up. What can be done for behaviors like this in kids? And I think as a parent, my concern would be, is this something that my child's going to deal with now for the rest of their life?
I don't believe it's something that they're going to deal with for the rest of their lives. These young minds have a very interesting way of dealing with crises, which is essentially what happened because their worlds turned upside down and they couldn't necessarily understand exactly what was happening or what the future would entail. And so essentially their safety was compromised and their bodies and their brains went into overload, if you will. And so various obsessive compulsive behaviors or tics started to present. And we see this in children when they are dealing with stress. And it could be stress from school, emotional stress, psychological stress, even if they've had an addition or a loss to their family. And many times they will work themselves out. But I think it's important for parents to recognize it. And if these issues are becoming problematic, they're really interfering with their ability to perform their school, to interact with the family or with friends, then it's time to let your pediatrician know. But I think as life gets back to normal, as these kids start to feel more reassured that things are going to be okay, for a great majority of them, these behaviors may start to improve on their own.
The report also showed that cases of anxiety and depression were up significantly. You know, the biggest group that I think felt the effects were the 13 to 18-year-olds, at least in this paper. And I've even noticed some symptoms of anxiety in some of my very young children, which is really surprising to me. What can parents do at home, and when do they need to seek professional help?
I think at home, the most important thing for you to do is to be able to recognize that there is a problem and then seek help. Don't feel as though you necessarily need to have all the answers as to how to fix the issue. And even if it's just mild, it doesn't hurt to talk to your pediatrician or your family doctor, or if you have access to a mental health professional. That will definitely kind of keep you ahead in the your A game, if you will. And in terms of what parents can do in the home, I think it's very important for our kids to have a schedule when it comes to their sleep, their meals, and their school. Try to get them outdoors, particularly right now when our weather is nice before it starts to get too hot, and keep the lines of communication open. Make it such that your kids feel comfortable talking to you, and rather than talking over them, be sure to listen and just let them get out what they need to say.
All right, Dr. Nimisha Amin, so much to talk about here. I wish we had more time, but unfortunately we are out of time. Thank you so much for breaking this down for us a little bit. We appreciate it.
Of course, anytime.